Amanda Sager. I'm going to be your nurse today. Can I please have your first, last name, and your date of birth?
Elena Goichai, April 21st, 2006.
Okay, everything matches. I'm going to go ahead and wash my hands, and then we'll follow through with assessment. Okay, do you have any known allergies?
No.
No allergies to any medications, food, or any environmental factors?
No.
Okay, thank you. As we go ahead and assess the patient's general appearance, we can state that the patient is in no acute distress, sitting upright on the bed, appears stated age, and is dressed appropriately due to the weather. Now we will go ahead and assess the patient's orientation. Can I ask where you are?
The bedroom.
And can I ask you to verify the date and time?
Thursday, 5 p.m.
Okay. Patient seems alert and oriented. As the patient properly follows commands, we can go ahead and start assessing the patient's pupils. Now we will go ahead and properly assess the patient's pupil by using a pen light. So can I just have you follow the light, please? Okay, the patient's pupils are equal, round, and are reactive to light and accommodation. Now we will go ahead and inspect the patient's skin. As we can see, there are no signs of any lesions, open wounds from any previous traumas. And as we go ahead and inspect the nails, we can see that there are no signs of any loss of oxygen, showing signs of cyanosis. Now, do you have any moles that you would be concerned of that would be changed in size or elevation, or any moles that are giving you any problems?
No.
Okay. And as we go ahead and inspect the patient's skin temperature, we can state that it is warm as we assess that with the back of our palm. Now we will go ahead and assess the patient's muscle strength bilaterally on their upper and lower extremities. So I'll start off with your arms. Can you go like this for me? And against my resistance, push forward. Okay? And along with your lower legs, against my resistance, please push forward. Okay? Both upper and lower extremities bilaterally would be graded 5 out of 5. Now we will go ahead and inspect the patient's precordium. By doing so, we can see that her chest is symmetrical and has no visible signs of any lesions or palpitations. Now we will go ahead and palpate the patient's chest for any tenderness, heaves, or thrills. So when I press on your chest, just let me know if you feel any pain or tenderness. You feel any pain or tenderness?
No.
Okay, thank you. After properly inspecting and palpating the patient's chest and finding no signs of any abnormalities, we can go ahead and start assessing the patient's cardiac fields. First, I will do so with my diaphragm. After successfully listening to the patient's heart, we can identify that there are no signs of any murmurs and the patient's heart is clearly heard. Now I will go ahead and listen to the patient's heart rate using the bell of my stethoscope. As nothing was identified when listening to all points of her cardiac fields, we can properly say that there are no signs of any murmurs, as S3 and S4 sounds were absent. Now we will properly go ahead and assess the patient's heart rate by measuring her radial pulse. I see your hand, please? Thank you. After properly assessing the patient's heart rate on her left radial artery, we can go ahead and say that the patient has a normal heart rate of 74 beats per minute with a grade of 2+. Now we will go ahead and assess the patient's AP diameter, as it is 1 to 2 and there are no signs of any edema. Now we will go ahead and properly listen to the patient's lung sounds using the diaphragm of my stethoscope. Take a deep breath for me. Every time I move the stethoscope, please take a deep breath. Can I have you stand up so that way I can listen to your posterior lung fields? And just face this way, please. Thank you. Okay, thank you. You can have a seat. Lung sounds were heard successfully bilaterally on both anterior and posterior fields. Now we will go ahead and start assessing the abdomen. As we inspect the abdomen, we can state that the patient's abdomen is flat, and we will jump right into auscultating the patient's abdomen in all 4 quadrants. Make sure that all those bowel sounds can be heard. Okay, bowel sounds were heard in all 4 quadrants, and we will go ahead and start palpating the patient's abdomen with light palpations to start. Just let me know if you feel any pain or tenderness, okay? Okay, after that we will go ahead and continue palpating with deep palpations. Okay, did you feel any pain or tenderness?
No.
Okay, thank you. After properly finishing assessment, we will go ahead and ask the patient if he or she has any questions. Do you have any questions for me?
No.
Okay, I will see you next time for your yearly checkup. Thank you for coming in.